Hello, and welcome to Obtaining Support and Ongoing Care for Children with SMA After Gene Replacement Therapy, a 6-module series presented in collaboration with Cure SMA and the National Organization for Rare Disorders. My name is Dr. Mary Schroth. I am the Chief Medical Officer at Cure SMA. Module 5 is Nutrition and SMA. For this module, I am joined by Becky Hurst-Davis, Registered Dietitian at Intermountain Health Care in Salt Lake City, Utah. Also with us today are Amy Medina and Amanda DeVay to share their perspectives as mothers of children with SMA. The series learning objectives are noted on this slide. In this module, we will discuss the therapeutic importance of maintaining optimal nutrition in patients with SMA. Now let's talk about nutrition and SMA. Let's start off with an audience poll. Please answer the following question. I feel adequately informed about the special nutritional needs for my child and how we may address feeding challenges. A, strongly agree. B, agree. C, neutral. D, disagree. Amanda, could you please speak to us about Brandon and any differences before and after treatment related to his nutrition?
Sure. So my son Braden did get his treatment at 22 days old. He was orally fed from birth, so he did do an okay job of gaining weight, eating orally, just regular infant formula. He continued after treatment to gain weight and sustain his weight normally being orally fed. Again, just regular infant formula. And then at 6 months, we did get the okay to go ahead and actually start eating purees. So he does eat solids, fruits and vegetables. I'm doing really well with that. So we're really fortunate that because we did have access to treatment early on, he was able to maintain his independence and eat 100% orally, and so far a normal infant diet.
Thank you so much, Amanda, for sharing about Braden. Now I'd like to turn it over to Becky Hurst-Davis.
Yes. Hello. So I just wanted to talk a little bit about some common nutrition issues and feeding problems that we see in kids with SMA and our adult patients with SMA. So with SMA, you can often see poor head control and weak swallowing muscles, and this can make it very difficult to eat safely. In addition, our patients will often have contractures that can affect their ability to chew or cause fatigue while eating. So when we're attempting to feed someone who's having these issues, this may lead to increased choking, coughing, or fatigue. Sometimes this increased choking can cause aspiration or inhalation of the food. And this is very serious because it can lead to pneumonia. What we'll often also see in SMA is we'll see GERD, so gastroesophageal reflux disease or indigestion with our kids who have SMA. We'll also have constipation, which is very, very common in kids and adults with SMA. All of these problems can make eating and getting enough nutrition difficult. And poor nutrition can cause failure to thrive. And in these cases, sometimes feeding tubes may be necessary to avoid these problems. Some possible solutions to feeding problems. So what we'll often see is if somebody is having problems chewing, we'll change to softer or easier to chew foods. In this, we'll also sometimes, instead of thin liquids such as water consistency, we may thicken liquids to what we call nectar or other thicknesses. We'll also maybe consider some orthotic devices. Sometimes we'll even have specialized tableware, specialized bottles that help with the sucking, swallowing, preventing from getting too much liquids at one time. What I strongly advise is that changing of food thicknesses or using orthotic devices, we often will refer to our speech-language pathologists and occupational therapist counterparts. In addition, if there are feeding issues, sometimes we may have to look for nutrition supplements. So this can be multivitamin mineral supplements, or it can also include nutrition drinks or special smoothies that we have with special ingredients to help boost the nutrition of the food and fluid that is consumed. In addition, especially for gastroesophageal reflux disease or constipation, we'll look at medications to help with this. We'll often also consider probiotics, which can help with constipation and other GI issues, as well as improve immunity, boost immunity. Feeding tubes, sometimes if we take these steps to pack our nutrition in, use nutrition supplements and nutritional formulas, or even change the recipe of infant formulas to help boost the nutrition. If we still can't get enough nutrition, feeding tubes can be needed. And sometimes they range from just helping to top off nutrition to providing 100% of nutrition needs. And it's just very individual to the person affected. Historically, in SMA, we would often see undernutrition and low weight in people who had SMA type 1, and overnutrition and overweight being an issue in SMA type 2 or 3. Now I would say that we kind of change that to where if you are more severe in your symptoms, you're more likely to have to at least need to be aware of watching for undernutrition. And if you are less severe in your symptoms, but less ambulatory, then you want to be really watchful that reduction in movement and moving less doesn't contribute to being overweight. Okay, so the effects of gene replacement therapy on oral food intake. In the SPRINT study, patients with SMA type 1 were treated before exhibiting symptoms, so they were asymptomatic. All 8 of the children in the study as of December 31st, 2019, they were able to eat orally and did not require any feeding support. In the STRIVE study, they looked at patients with symptoms who had SMA type 1, and they were treated before 6 months of age. By 18 months of age, 19 out of 22 children in this study who were able to eat orally, and they did not require feeding support. When we look at optimal nutrition for people with SMA, it's a trick question, because you look at the population of in your area, and you'll see that a lot of people eat a lot of different diets. Every diet is individual to a person. And so because of that, we don't have any single diet recommended for people who have SMA, just like in the general population, we don't have any one single diet. What we look for to optimize nutrition is we look for a balanced diet where you're having fats, protein, and carbohydrates, a good balance. Your healthcare provider can help offer individualized advice for your child. And it often depends on what your child is tolerating, how much volume they can tolerate at a time, if they have certain reactions or conditions to certain foods. You just really want to be watchful with that and work with your healthcare provider. For some of our patients who have troubles eating or volume tolerance is an issue, we'll look at smaller, more frequent meals. It can be easier to consume when you're doing it in smaller portions. So what we'll see is that we'll see that kids who are moving less or have less lean muscle mass, they'll need less calories than somebody who doesn't have SMA. And this can be highly individualized based on the amount of lean muscle mass, the amount of movement your child or the person with SMA has, as well as if there is additional issues with work of breathing, can also affect the amount of calories that is needed by an individual with SMA. Another way that we can optimize nutrition for people with SMA is to recommend vitamin and mineral supplementation or other nutritional supplements or formula drinks. What we'll do is we'll look at the intake that your child or the person with SMA is taking in, and we will look at also nutrition labs to help us determine what vitamin or mineral supplements we would recommend if additional calories are needed that we can't get to with foods. We'll also look at recommending foods that may help to boost that nutrition to help optimize it. We'll also look at lower fat, heart healthy diets to help if there are symptoms of GERD or reflux. What we'll often recommend dietarily is decreasing fried foods, increasing heart healthy fats, so things with olive oil or avocado, salmon, healthier fish options such as that will help to minimize some of the effects of GERD. Concerns about fasting and blood sugar levels. So we do have some patients with SMA who have issues regulating their blood sugar levels. This is usually related to the amount of lean muscle mass, as well as the severity of SMA symptoms. But if you have too much time that goes by between eating food, so when you're fasting, this can lead to low blood sugar levels, what we call hypoglycemia. You can also, when you are not getting enough blood sugar, your body will go into this catabolic state where you start to break down muscle and fat to help give your body energy. Both of these things may worsen when your child is sick. So what we look for is getting adequate nutrition especially during times of stress or illness. Some signs or symptoms of hypoglycemia that we'll see increased sleepiness, fatigue, confusion, increasing in tremors, headache is often a sign of hypoglycemia. To help minimize these risks, again, if you're ill, I cannot stress enough to limit the fasting. However, the fasting times are really individual to your nutrition status, the severity of SMA, what exactly is going on. So while you're well, you could fast during the day just between meals, so eating meals every 4 to 6 hours. At night, if you're able to go without feeds overnight, that really just does depend on your nutrition status, how much extra, how well nourished you are, how much you weigh, how severe your symptoms are. I would ask a dietitian for guidance about your meal content, as well as your medical provider if you have questions about whether or not your child is safe to go overnight without nutrition, or some strategies to help to boost the amount of time that you can go between meals. Sometimes if we have people who overnight are maybe getting a little hypoglycemic, we might recommend a snack at night that has a protein and fat and a carb to help get them through the night. It's just really individual to what your child is experiencing or the person with SMA is experiencing. So why good nutrition matters. So I cannot stress this enough. If you are better nourished, you're more likely to grow easier. You can breathe more easily. You can fight off infections more effectively. People who have good nutrition have improved motor function. Additionally, good nutrition helps to promote a better quality of life, as well as helping to prevent against other diseases, chronic diseases in life. What we'll do and why we often look at nutrition is we will track growth over time to ensure that your child isn't eating too much or too little nutrition. One thing that we'll also do is we'll also look at other measures of body composition, and track over time is important. So if we can see that your child is growing on a certain curve, we'll probably want to look for them to continue on that curve. We're not necessarily looking at any particular spot in the curve. That is very individual to the child. and the amount of fat and muscle that they have. And so we'll check additional body composition measures. In my practice, I will check a mid-upper arm circumference just to keep tabs on the children that I see to make sure that they're growing appropriately and they have appropriate fat stores in case they were in a situation where they were unable to feed for a large amount of time, just to make sure that they were doing okay that way. So that is all that I have to talk about for nutrition. Amy, can you kind of tell us about the experiences that you've had nutritionally with your kids?
Yes. So all three of my kids are very different. Mateo was aspirating pretty much from the get-go, and so he received an NJ tube at 2 months old, and then a G tube right before his 3-month birthday. And he is all G-tube fed, and he does not go more than 4 hours between feeds, and he eats continuously at night. For Javier, he's a little bit of a mystery. We're still working on things with him. He's maintained a good infant diet, proceeded to go into purees and then some table food, but then he started having some choking episodes. And so things that he could eat, like eggs, he choked on. So now he never wants to look at eggs again. And so we had to do a series of swallow studies with him, and we learned that he was getting close to aspirating. And so we moved into an NJ tube with him. Then he's strong-willed and knew what it was like to eat orally, so he did not want to give up that oral feeding. And we talked to our team extensively about that and recognized that we need to just monitor him more closely and allow him to have that joy of oral eating, but make sure that he's doing it safely. And so he is a very picky eater. He drinks a lot of milk and a lot of junk food, but other nutritional stuff, he just doesn't want anything to do with it. And we also think it's some sensory issues with him as well, because the sight of certain foods will just make him start gagging and choking. But cookies will not. That's one thing that he'll eat a whole package of cookies with no problem. So he last summer, when he was 3 years old, he did receive a G tube, and so we do give him supplement nutrition overnight. And we basically just watch what he eats during the day and kind of monitor how many calories he's getting and kind of adjust it at night on what we feel he needs, and then give him some water and sometimes Pedialyte with that feeding. And then for Amelia, she has done amazing. We've not seen any issues with her eating orally. She has just gone through, like from formula to table food to she just eats everything. But all three of my kids are followed closely by a dietitian. They're seen every 4 months. So their weights are checked, labs are drawn, and we adjust in areas that we see fit for each kid.
Thanks, Amy, for sharing your nutritional experiences with your kids. I can say that I do see ranges like that in my practice with kids who have gotten therapies at different times in their progression of SMA. So I do see a wide variety of individualized needs across the spectrum. So thank you for sharing that. Mary?
Thank you again, Becky, Amy, and Amanda, for providing us with an informative discussion. I'd also like to thank Cure SMA and NORD for their participation on this program. Please visit the following websites: NeuroCareLive.com and RareDiseaseLive.com to view the rest of the modules in this series. Support for this caregiver education program was provided by Novartis Gene Therapies. Please remember to complete the questions at the end of the module to help reinforce some of the topics we covered today. You can also download the presentation slides found in the Event Resources section of the player located under the video box. My name is Dr. Mary Schroth. Thank you for joining us.